Alright, it's recording. So, we get to sit down, have a conversation about psychotherapy now.
So you asked me earlier about young lady comes in, referred to counseling against her will.
Yeah.
Very unhappy. So she comes in and is just loose streaking.
Mm-hmm.
You mother effing this therapist bullshit, that blah. And so she starts attacking me, and the way she was approaching me, I could tell that I intuited, and I could have been wrong, so what I did was risky. But I intuited that she was used to therapists being very emotionally neutral, trying to be objective, which many people have been treated neutrally and objective while they've been abused, then mistrust objectivity and neutrality. So I give it right back to her. You coming in here all tatted up like a $3 saloon on a Saturday night and cussing at me. So we just, boom, we butted heads, and we were yelling at each other. I'm sitting down in my chair and I'm yelling at her and she's yelling at me, and I'm getting louder and she's getting louder, and she says, "Oh, so you're one of those, huh?" And I said, "One of what?" And she goes, "You actually care." And I said, "Yeah, that's why we're yelling at each other." She goes, "Cool, okay." And then we really worked well together for a few months.
Wow.
So how do we interpret this? And that's what your question was. Like, how does that make any therapeutic sense? First of all, going on record, it was very risky.
Yeah.
It was very, very risky to do. Second of all, our intuitions can be wrong. And this is what our empirical colleagues live in fear of.
Mm-hmm.
And they very much test and show how often our intuitions can be wrong. However, sometimes our intuitions are right.
Mm-hmm.
And so in that particular case, given the content of what she was swearing at me about, I could tell that she did not believe that I cared, and that I would treat her as neutrally and as indifferently as all the other therapists that she'd had to that point. Does that make sense?
Mm-hmm.
And so by my getting equally passionate with her, it showed that I was not one of those. So her position is, I don't trust you. And my position was, you can trust me. And paradoxically, we communicated that by yelling and calling each other horrible swear words for 10 minutes.
So now, but that took a lot of interpretation on your part, a lot of breaking through the hermeneutic crust. Because you had to really break through the crust of what she was saying.
Was it encrusted? Well, I guess you're right, because if she's coming at me and saying, this is what you are, and she is already walking in the door mistrusting me, then that gives me something to break through. But I can't do that if she's not willing to break through it as well. And so that's why you and I talk about relationality. Like, if she had walked in, cussed at me, and stormed out, then there would have been no breaking through the crust. But there was part of her that had to hope that I would care enough to be passionate about her opinion, her position, her point of view, or herself, basically, that I would respond in kind. So as I'm fighting back with her, she got it, that I cared enough. You know what I mean? That I was willing to get passionate, that I had emotion, I wasn't neutral or objective. So did that break through the crust? Yes, but I would like to think that she wasn't supporting the crust. I think that she was putting the crust in my face, hoping I would break through it.
I agree. At the same time, though, well, first we've used two terms that I don't know that everyone might understand, but we've used hermeneutic crust and relationality. And to me, relationality is just this idea that we are relational beings. We exist in relationship. I am not a human being until I am recognized by you in my relationship to you.
So that has some very interesting philosophies behind it. Marriage and some that you and I have talked about before, where I don't have to take you up as a human being.
Right.
In fact, that now we just added a new term, which is to take up. To take up means to interpret people and to open my experience to. So if I'm taking you up, that means that I am interpreting you and treating you in a certain way. Okay? So if I take you up as an object, and I take you up like that, then I treat you not as human, but instead as an object. And you may be crying in my face, I am a human, I am a human. Attend to me, listen to me, care about me. But if I take you up as an object, then I do not attend, listen, or care. So Giorgio Agamben is somebody you and I have talked about before, who talks about how human atrocities happen because human beings are scapegoated. This gets into mimetic theory.
This is mimetic theory and Rene Girard.
Yeah. So, like, if I take someone up as an object, for example, let's say I'm working at a place called Devereaux, and I'm working at this place called Devereaux, and I have a client that I'm working with in individual therapy or group therapy, and I don't like this kid. He's hostile. He's aggressive. It's never my fault. Man, it's not my fault. And distancing interpersonally, sabotaging relationships, and I take that kid up as borderline, right? If I take him up that way, then now I'm taking him up as a borderline object. I'm no longer relating to him, where the defeatism comes from, where the sabotage comes from.
Right.
Instead, I relate to him as object.
We're
and push him away.
We're not even acknowledging his relational history or the lack thereof.
Oh, exactly. So we're not taking him up as a human being anymore. Instead, what we're taking him up as is an object, a borderline object.
It's like the doctors and hospitals. I don't treat people, I treat diseases.
Exactly. And then you and I both know what the research says about the outcome of patients who have those sorts of doctors. It's not pretty.
It's not pretty at all.
So the other term, so there's relationality. Relationality, as you and I have talked about it, is co-constitution.
Mm-hmm.
Meaning that it's not just a matter of taking up, it's a matter of we are always entities in relation. And so we can grossly oversimplify and say short does not exist without tall.
Right.
Tall does not exist without short. Heavy does not exist without thin. Loud does not exist without quiet. That there are many characteristics we have as human beings that exist in relation. Human and non-human, for example, exist in co-defining relation. Carl Jung was very famous about talking about antithetical reasoning to that regard. So anytime I'm with a client, it's very humbling from the outset, because that client, by nature of being a client, always automatically makes me therapist.
Right.
And so I have this role, I have this task at hand because my client is a client. If my client walks in and is not a client, and I'm trying to take them up as such, but they refuse, then I'm not a therapist.
Right.
I am just a guy in a room. So a lot of these relationships are co-constituted. The other term you used was the hermeneutic crust. So how would you define the hermeneutic crust?
I would define it as breaking through the surface appearance of what we see in the behaviors to find the actual meaning and interpretation buried deep underneath the outward manifestation of their verbals, nonverbals, behaviors, things like that.
See, I hadn't considered that. So from your perspective, a hermeneutic crust could be a kid coming in wearing full gang colors.
Right.
That is presenting a certain meaning.
Right.
But the reason why he's wearing those colors, the reason he's manifesting that meaning, you would have to get through that layer of the appearance in order to get to what's behind it.
Right. But this, I might say, is what breaking through that type of crust. I would say we're only getting partway through the crust, because this is what your typical CBT, DBT therapist is going to do. Your typical humanistic and existential therapist are going to do is any therapist with a master's degree or an LPC or a psychologist with a PhD is going to walk in there, and if they are relying on even a fraction of their training, they're going to be able to say, yeah, here's this gangster dressed the way he is, but why is he this way? And they're going to fall back on things like Maslow and say basic needs. They want some belonging in their life. And so they belong to a gang. A gang provides safety by putting a roof over their head and food on their table. But the way
provides dominance and power.
Right. But the way that hermeneutics define breaking through the crust, which is not how I defined it intentionally, is very different. And that's the part I'd like you to elaborate on, to differentiate how CBT, DBT, humanism, existentialism, even Gestalt is going to break through this crust, whereas in hermeneutics and phenomenology, we're going to go a little bit even deeper than what they're saying.
Well, I don't know that we are so privileged that we can say that we go deeper than, say, a Gestaltist or an existentialist does.
That might be true too.
I think that our colleagues would rightly object to that. And in fact, thinking of our CBT and DBT colleagues, oftentimes, in my experience, is when we have these dialogues about the nature of a client's behavior, the nature of their appearance, the nature of their being in the world, the way they act, the way they behave, the way things mean to them, and the way they participate in human relationship, is that they don't have time to deal with it in detail.
Right.
I don't know if you've ever gotten that, is that all of those deeper questions, and they're very kindly reassuring to me, more often than not, those are interesting concerns, Matt, but we got to get them in, get them treated, and get them out. And so I'm okay, and so what does that imply? It implies you apply this particular method over and over again to the same client, regardless of concern, to change their behavior. Sometimes that's successful.
Yeah, it is.
So what can we learn from our CBT and DBT colleagues? Again, as hermeneutes, it's very easy for us to feel arrogant. It's very easy for us to go, we think of this so much deeper, and we're willing to ask questions that no one else is willing to ask. Well, the flip side of that is we're working with lovely people who have made their life's calling the amelioration of human suffering.
And many of them have done marvelous things in their practice.
Right, and so it's I would argue, morally incumbent upon us to continue to support those marvelous works. When you see a colleague, regardless of their theoretical orientation, go out of their way in care and in service for a client, I want us to be there, patting them on the back.
Yeah.
And saying, you inspire me, that's the kind of good work I would like to do. And so they can do that above and beyond that really meaningfully engaged, really caring and engaged work from a DBT and CBT perspective. It's a little bit harder given that there are some claims to objectivity in CBT. I don't see that language as strong in DBT, but I do see that language quite strongly in CBT. However, they can still do really good work. So our missions are a little bit different. Their missions are, we treat symptoms, we don't treat causes. And that's where hermeneutes and CBT folks can work very well together. I don't treat symptoms. I really don't.
No. I
I treat causes. And so, unfortunately, getting to causes, for example, in a clinic I worked in, oh my gosh, 13 years ago? Holy cow, okay, 13 years ago. I worked in a clinic where we were given a 10-session model. So we had to get them in, get them assessed, treat them, and get them out in 10 sessions. Oh boy, given that to do a thoroughgoing phenomenological assessment takes hours and hours of conversation to really plumb the depths of meaning, I'm up a tree, as a hermeneutic. So what I learned from my CBT colleagues were ways of asking questions differently to get a sense of the nature of their suffering quickly. Now the cause of suffering, that still took time. But oftentimes the clients would, I think, justifiably complain that we were just really getting into the meat of things when they were really starting to see potential for lasting, lifelong lasting change when the 10 sessions were. And so that's something that our CBT colleagues can help us with. Likewise, what we can help them with is asking a little deeper questions, something that will maybe open up possibilities beyond what we call in phenomenological hermeneutics the mere manifest, that which is just surface. How do we get beyond the surface depression? How do we get beyond the surface anxiety, the surface aggression, the surface violence for those of us that work in corrections, or to something deeper? Or
even more to the point, how do we get past just the mere thinking?
Right, exactly.
There's more to a client's life than just their thoughts and their feelings.
Well,
I mean that with compassion towards
of course,
CBT. We're talking about the difference between how a CBT and a DBT can breach the hermeneutic crust and how a hermeneut can breach the crust. But we're also talking about in these differences, there's some compatibility and compromise, or complementing might be the better word, to help us. So when I sit here and I say, how do we get past just the mere thoughts, because there's more to a client's life than just their thinking? You know, I'm asking that question in the spirit of now a hermeneut complimenting a CBTer, whereas you just finished talking about where a CBTer can complement a hermeneut.
Right, well, certainly. And there is a very important question in some of the articles that, you know, you've alluded to this in some of your scholarship, and I've written on this and published topics on this area. Sometimes, unfortunately, we can thicken the hermeneutic crust or perpetuate it. So a kid comes in and I take him up, like in prison, for example, if I take up my clients as bad guy who need to be changed in order to become good guys, I'm actually thickening the hermeneutic crust. Many of these men do not experience themselves in that way. So we have to be cautious about not doing that. So a lot of the CBT programs I saw in prison actually thickened the hermeneutic crust, that they actually would have guys buy into this. I have stinking thinking.
Yeah.
You know, these thinking for a change models, that everything's about thought. But oftentimes that goes out the window when they're walking next to their friend in prison and another group of men come up and start assaulting their friend. They don't have time to sit back and think and check my stinking thinking. Instead, it's very reflexive. You attack my boy, you're attacking me, and it's war. So, you know, their friend gets hit and they tackle on the guy who hits, and then that guy's get tackled, and it's a brawl.
Right.
You know? Well, if you and I were walking down the street together, and let's say we're, you know, Provo, Utah, very, very low crime rate, and just happens somebody comes up and clocks you, if I sit and I'm like, you know, thinking rationally and trying to dialogue while you two are beating the hell out of each other, I'm not effectively intervening.
No.
And so instead, it's one of those where you get hit, then I'm gonna hit somebody, and now we've got a brawl on our hands.
And opposite action, unfortunately, is not going to help save you on that one, because you may try to use opposite action and walk away, meanwhile your friend's getting the hell beat out of them.
Exactly.
So there's a very real moral issue that I think sometimes is not reached when we thicken the hermeneutic crust. There's a real moral issue in our clients that we don't penetrate the hermeneutic crust to get to see it is morally good to defend your buddy.
Oh, right. Well, what you've done there, though, is a very interesting, and again, what we can bring our CBT colleagues. What's very difficult for many therapists to understand, and it's very painful for us to think about. Even those of us who are phenomenological hermeneutic and orientation and in life philosophy, I have great capacity for evil. Like we sit here and we're sitting in, or there's a big axe behind you, a flail right here, a sword.
I'm carrying a 9mm.
You're carrying a 9mm. So here it is that we have these instruments, these symbols of violence, these symbols of times and in places when warfare, well, I don't know if there's ever such thing as compassionate war, but when we did great atrocities.
Yeah.
So for me, these are not symbols of my desire to do violence to other people, but a reminder that we all have great capacity for violence.
Philip Zimbardo being very good at reminding us of this.
And he participated in great violence in the
Mhm.
Stanford study.
Right.
If you've read the background to that, Zimbardo was the one giving the orders that made the experiment become so violent.
Right.
And a lot of people aren't aware of that level of the research.
Well, you know another. Oh, sorry. No, go ahead.
No, I was just thinking that by me acknowledging my great capacity for violence isn't to then say necessarily I'm going to be violent or I'm going to behave violently, but rather it helps me relate compassionately to people who have been violent.
Mm-hmm. Right.
The difference between Buber's I and Thou, which you said you're going to read soon, is when I am working in maximum security prison, and I've worked in jails and prisons, as you know, for many years, and a man comes in and speaks to me, I treat him as I would want somebody treating me. That, let's say he's killed somebody. I am not the vehicle of justice or retribution. That was taken care of by the court system. I am now the bringer of mercy and compassion.
Right.
Because I prefer not to tell these stories in the setting, but, you know, maybe if you and I are on a walk or something, but I have come very close to committing great violence in my life. And I saw at the time the necessity for that.
Mm-hmm.
And I recall with horror those moments. Not because I didn't want to be there, I didn't want to be a violent one. And sometimes men in prison feel the same thing. The difference between therapist and client, good guy and bad guy, are called into question when we realize I have suffered and have caused suffering. They suffer and have caused suffering.
And in there we can relate to one another. This creates our shared context through relationality of I am relating to you. A prisoner's capacity for violence is not there until it is relationally acknowledged by a second party. Like what McMurray says, there can be no man until there is two men, at least, in conversation.
Mm-hmm. And in fact, there are, I don't go quite this far, but there are post-Bakhtinian dialogical scholars who argue that personhood, like even being a person, requires language and relation.
Yeah, absolutely.
And I'm a little uncomfortable with that, because you look at like feral children, and so is a question, was that person a person when they were wild,
Right.
you know, locked in a basement, and urban feral children running through the wilds for rural feral children? There was a capacity there beyond the animal, and behavior there beyond the animal. Even though they were non-language using creatures,
Right.
even though there was no one else present, there seems to be something unique about them that I can relate to differently than I can relate to an animal.
Right.
Now, that may be something I'm bringing, but I would like to think even if I'm not there, there's still more than just an animal.
Absolutely. Absolutely.
So there are those who radicalize it, but there are those who are more tempered in their perspective. So back to this idea of relationality. How do you then, so you're working at Devereaux and you're working with largely troubled youth, although some of the stories that you told me, again, while keeping confidence, don't know a lot of details, but the impression I got is that a lot of these kids' behavior makes sense.
Yes.
Like when you hear about their backgrounds, their life situation, what they'll go back to after they leave Devereaux, a certain way of behaving works better, and just on a pragmatic level, than the just be rational and be calm and follow society's rules. That doesn't necessarily work.
Well, there's two ways I would look at that. If we're saying follow society's rules, be calm and be rational.
Which society?
Which, yeah, it is. It's which society, because as I've shared with you, many of these clients, and my colleagues at Devereaux are not blind to this. I've got to give them credit to that. They're fully aware of this. We send them right back to the environment that their behaviors grew out of. Like two stories come to my mind. I worked with a client in my group session back in April of last year, so I was still fairly new group therapist. And this client was talking about how he was in a gang and there was no getting out of it. And we were talking about ways to change and modify behavior in a way that becomes more pro-social, more compassionate. And he says, I can't do that, because when my OG comes up to me and tells me, you need to do this, I need to do it. If I don't, they're going to beat me or kill me. And so here, the rational thing to do then becomes, do what you were just told so you don't die. It's just basic self-preservation. That's the rational thing to do. Opposite action is now used in the way of, I don't want to do what he says, but do the opposite of an unhealthy urge and follow him so I don't get killed. Does that make sense?
Mm-hmm.
And so...
But I'm wondering how, like if we're teaching people to check their stinking thinking, how that would even help this particular...
Well, the thing is, either it wouldn't help them, or they would use... Humans, as you know, are extremely adaptable. They would adapt the CBT and DBT principles to match their environment, rather than just taking a set of therapeutic principles and trying to make the environment change because of the principles. Mm-hmm. They would bring it to there. So right here, this client that I was working with, who actually AWOL'd from the facility the very next day after I told him, do what you got to do to survive. I've often wondered, I can't say for sure, but I've often wondered if that session had something to do with that, because from what I understood from shift reports, it wasn't planned. And he just walked. He just walked, and I've often wondered, and I'll get to why I wondered in a second. I'm getting ahead of myself. But he understood that no amount of distraction, no amount of opposite action, no amount of reframing, no amount of using the ABCD model was going to change his behavior in the context of the environment he was in. It just wasn't going to happen. When you and I would refer to this as solipsism. Instead, what needs to happen is he's forced to abandon his therapeutic learning altogether, or he's forced to adapt the therapeutic learning to match the environment. My OG just told me to go rob this person so we have money to buy drugs that we can then sell and make more money of. I don't want to do this, but I have to do the opposite of what I want to do, opposite action, so that I don't get killed by this guy later. Another story that comes to my mind is the client that I worked with that I told you about, that we're actually using in the we're using the vignette of for our presentation in San Francisco in November. He was a Crip gang member. This was just back in November. Actually, it was October that this happened, end of last year. And he was. We had an influx of blood gang members come in. All, I don't know, I'd say over the course of a couple of months, to pretty much the tail end of the summer, we had them come in. And they find out my client is a Crip. And they start making threats. Staff members at the school overheard these threats and warned me about it. So I went and talked to my client and I told him, I straight up told him, watch your back, they're gunning for you. You know, I didn't even try to give him any type of therapeutic intervention of like, you know, challenge your thinking about fighting and fighting's not good. And I didn't even say any of that. I just said, watch your back, I'm warning you, they're gunning for you. And he says to me, I really appreciate you giving me the heads up. He doesn't word it like that. He uses his gang lingo, of course, but that was the message. And then he says to me, he knows he has a discharge coming up soon that he's worked very diligently towards getting. And so he says to me, if these boys jump me, it ain't in me to just take it. And so what I want to know where you, as my therapist, will stand to my CFT if these boys jump me. And so, you know, I'm thinking here for a second, and I knew that the answer had to be something outside of a therapeutic context. Because the answer can't just be challenge your cognitive distortion here. It is in you to just take it.
What do you mean by therapeutic context?
Well, yeah, you're right. That might not be the best wording. I guess what I mean is there was no real therapeutic rationale or therapeutic intervention that was applicable to this.
Oh, yeah, well,
that's what I
would
meant.
argue that there is.
Well, if I'm thinking from a CBT and DBT perspective,
right. But
there is.
there are many other viewpoints.
Right. If we're looking at existentialism, hermeneutics, maybe even Gestalt, there are ones that we could use.
Yeah, because Gestalt, they would get very deeply into the experience of feeling under threat. Whereas for us, we're like, no, that's clear. This kid is being threatened, so what is him, you know, trying to talk his way out of trouble? Would that help if he's already under assault? Well, no, that doesn't make any sense. So instead, to give him, like you said, a heads up,
Right.
that serves multiple purposes. One, it helps keep him alive. That's the most important one. Number two, he knows that somebody cares.
Yeah.
And that's you. And that helps as well.
Mm-hmm. It does. And, you know, so I told him, I thought for a second, knowing that, you know, the moment he's attacked, everything goes out the window. And so I just told him, I said, and by everything goes out the window, I mean, you know, therapy, thinking rationally, what you were alluding to with your story about somebody seeing their friend getting hit on. You don't have time for rational thought in that moment. So what went through my mind was, what would I do if that was my situation?
So, willingness to put yourself in someone else's shoes.
Exactly. And that is how I developed my answer to say to him, so long as you promise me that you will A, not be the aggressor, and B, you will do everything you can to remain in staff eyesight so there's a witness that you were not the aggressor. If they then attack you, you flail on them and do whatever you need to do to keep yourself safe, and I will go defend you to your team. And he did not say a single word. He just, his eyes just lowered ever so slightly, and he just nodded his head. And it was almost as if he was saying, I appreciate that.
Or I understand.
Or I understand.
And so did John, quote unquote
Right.
John, did he ever end up getting in trouble, or was he
No.
able to avoid the bloods?
He was able to avoid it. And as I would walk around campus and the dorms and the outside area, I would see him staying by staff, even if that meant he was sitting at a bench table all by himself. So he was in staff eyesight. And I think it actually served a purpose that I didn't foresee when I first told him. Originally my intention was to say, you will have a witness that it was self-defense, but I think the byproduct that we got out of it that was unforeseeable, or at least for me at the time, was that while he was remaining in staff eyesight, those bloods weren't going to go after him, period.
Right, they were smarter than to do
Right.
that. There's another level, though, of change that happened here. It's subtle, but it's important. Your client, quote unquote John, was not the aggressor.
Mm-hmm.
There we see a significant difference from street behavior. In street
Right.
behavior, someone puts you under threat, you get them first.
Right.
Saw that a fair bit in prison. So we have John not aggressing, willing to defend himself. You valued his life, he values his life. You value his safety, he values his safety. And the two of you were able to do something different than has been done before. Now, will he be able to transfer that way of being, that experience outside of Devereaux? Maybe or maybe not. But at least now it's a possibility.
Right. And I would argue that it only became a well, I don't know about only, but the driving influence that made it a possibility was that he knew how much I cared before he saw a therapist giving therapeutic intervention.
Mm-hmm.
You know, kind of like, you know, that old adage, you know, they'll never care how much you know until they know how much you care. You know, John was not going to care about any therapeutic techniques I had until he first knew that his safety was my top priority,
Mm-hmm.
and that I had the care and the compassion to see through the rationale, to see through the therapy, to see through the laws, to see through the pro-socialness, and just say, what do we do to first keep you alive?
Yeah, well, a minute
And
ago,
safe.
Exactly. You and I, a minute ago, evoked Alfred Adler.
Mm-hmm.
And Adler, if you've read Manister's work and Richardson's work on looking at Adler again through a postmodern lens, through a phenomenological lens, Adler was way ahead of his time, theoretically. And so, unfortunately, his writings are very scattered and obtuse, so he doesn't like write out solid theory like Freud did, or like the cognitive behaviorists did. Instead, Adler refers to different things in different ways at different times. Adler talks about what he calls social interest, which is a caring for another or caring for all others under the aspect of eternity. So if I have social interest in my community, say I'm in a community of therapists at Devereaux, I'm not just in a community of therapists, I'm also in a community then of clients, because remember, clients and therapists co-constitute each other.
Right.
So it's incumbent upon me then to care for these people, to care for my colleagues, my fellow therapists, and for my clients, who then make me a therapist by their very existence. So, in talking to John in this way, you had compassion for him, the social interest for him. John mattered to you, and a lot of good therapy is very risky because it's allowing another to matter. What Heidegger refers to care, which is that being matters for us.
Mm-hmm.
Us as more relational thinkers, not to exclude Heidegger, this would thank him for this, because he got us started, but is to allow the other to matter.
Right.
And that is that our care is not just care for being individually, it's a care for co-being, a relationship.
This is the Bakhtinian sense of the word care, right?
Yeah,
Bakhtin.
much more Bakhtinian. And so, for this, however, you and I need to humbly acknowledge is very risky. If we allow other people to matter to us, then we're risking being hurt by them. And if we don't know how to manage that mattering, that care, then I've seen some therapists burn out in the face of it. They're told they care too much.
Yeah.
And that they begin to suffer greatly.
There's 2 points I want to make here, and I don't know if by going off on one we derail the other, but there's 2 points I want to make here. I guess I'll start with the one that we is a little quicker, which is, as a therapist, we learn how to have this care, not only in the sense of Heidegger, where I care about myself, but in the sense of Bakhtin, where I care about others. Yeah, I care about being. Yeah, care about being from an individual point of view, whereas in Bakhtin, we care about being from an other point of view. We allow ourselves to care, and sometimes we end up, as therapists, burn out if we don't learn how to deal with that. But along the way, before the burnout, if we don't learn how to deal with it, then we don't learn how to teach our clients how to deal with it as well. And then they end up getting hurt in the future when they go out into the world by their friends, their loved ones, their families. they don't learn how to deal with that, which then runs the risk of them collapsing more and more into their own encapsulated shell of being, of, you know, not trusting people, not willing to branch out, not willing to make friends.
Well, not willing to emotionally risk.
Yeah.
Yeah, and that's certainly what these relationships represent.
Then the second thing it reminded me of, especially thinking about it from a therapeutic context, is this idea of countertransference now. Obviously meaning the more colloquial sense of the term, where just having subjective feelings of compassion and...
So we're not actually talking psychoanalytic?
No, not the psychoanalytic, which you and I discussed on Monday, you know, where you're just becoming emotionally enthralled with the person, you know, or entangled with the person.
Yeah, where your neuroses become enmeshed with
Right.
your work with the client. Yeah.
Exactly.
That's more psychoanalytic definition.
It is. But I think the way that a lot of CBTers and eclectic psychotherapists use the term now, at least from, I can only say from my own experience of what I've observed, is countertransference is when we have any care or compassion at all. And an example of that...
Okay, but okay, so you've taken a step. I need to make sure I'm still with you. That countertransference in this it sounds like it's got a very tacit definition, but what it means is, if I care and if my client matters to me, then I am neurotic. Because countertransference, remember, is a neurotic process.
Right.
Or am I mixing the prosaic and the psychoanalytic
No,
together
you're mixing them, and I think that is where countertransference has been so wrongly used, and is actually the point I'm driving at.
Okay, so is countertransference from this prosaic model, this CBT eclectic way that you've been exposed to, that's very foreign to me?
And how I've even been trained.
Is countertransference from these people's perspective good or bad?
Bad.
Okay, so it's bad.
It's bad.
So countertransference is bad, like it is in psychoanalysis, but in a different way and for a different reason.
Right.
Okay, in what way is it bad from this perspective? I don't understand.
You lose your objectivity, you lose your value neutrality.
Okay, whoa. So we should be objective and value neutral with our clients? So everything that you and I have talked about then, about really allowing the other to matter to us, putting ourselves in their shoes, the core of compassion and empathy, is bad?
Empathy, the way I've learned it, is the idea of you don't feel what the other person is feeling. This is what this is just normal empathy. But you're able to just envision what that might be like. But you're not actually...
So whoa, it becomes coldly cognitive and not emotional.
Exactly. Which is why many people in our field, from more of a CBT perspective, have started to talk about a term called compassionate empathy.
Oh, good.
Well, it's good, but it's not well known. It's not well disseminated information. But to me, empathy was already compassionate. Why are we now calling it compassionate empathy as opposed to the contrast of mainstream empathy of I'm just able to understand how that might affect you?
Like a robot understanding a person.
Right.
I think your criticism is apt, and the clinical training I do with my students is I make it very clear that empathy and compassion are related and different. It's one of those, all thumbs are fingers, but not all fingers are thumbs kind of thing. I can be empathic and totally not compassionate at the same time. Meaning that if I understand on a very visceral level what somebody else is going through, I understand emotionally, I may have been there before, but I refuse to lift a finger to help and just don't care about their welfare. Well, that's a great deal of empathy with no compassion. And I've seen people do that, both in and outside of the consulting work. So I'm glad some of our colleagues in CBT are offering up this construct they call compassionate empathy. It's a step in the right direction. I hope it becomes broadly disseminated.
I agree with that. But I do want to share an experience of a colleague of mine who had the empathy in the compassionate sense of the term that we use it in phenomenology, relationality, hermeneutics. And it's an example of where she had a client attempt suicide back in November of last year. It was November of last year. And he almost completed. When the staff found him, he was blue, and she has a client now. That client ended up being saved. Everything was fine. Staff had done their job and maintained well enough. Fast forward to August of this year. That same therapist, that same colleague of mine, has a client now, a girl this time, who is extremely suicidal, and she was trying to say in our group supervision to our supervisor, our assistant clinical director of residential operations, she said to him, "I'm getting worried that we might have another one of," and she called her former client from November by name, "on our hands here with my new client." And her supervisor, our supervisor, says to her, what are you doing right now?" And she looked confused for a second. He was like, "Aren't you having some countertransference right now?" And she didn't really say much about it because, well, I don't really know why she didn't, but my guess is because she just didn't want to be argumentative, or she was trying to learn, or...
Well, that and therapists are very, very thoroughly acculturated not to contradict their supervisors.
Right, exactly. And so she, the supervisor says to her that kind of countertransference, we should be avoiding that. And I'm thinking to myself, well, first off, she's contextualized by memory, and memory has nothing to do with countertransference in the sense that it's used prosaically and colloquially by our colleagues today.
Not accurately or well.
Right, exactly. Secondly, it has nothing to do with countertransference. She has empathy. She cares about this client. She has compassion for this client. She is genuinely, legitimately concerned for this client's well-being. And she was told, "You're having countertransference."
You're thinking your care is bad, is the implicit message. The way you think about this client is bad,
Right.
caring about this client in this way is bad.
Right.
Okay, so, it's always risky Monday night quarterbacking somebody else's game.
Yeah, exactly. We obviously, this supervisor is not here to share his point of view and defend anything. We want to be careful
Right.
about that.
However, there is something that we get to do, and that is, how can we be compassionate and can we support your colleague without contradicting the supervisor?
Right.
And putting her in that difficult, feeling caught in between situation, but instead, what does she need from you? Like, what could you do to help her?
Well, I think the first thing I would want to do is just validate her. Say, "Hey, I get it. You care about your client. You have compassion for your client. And you are trying to let that client know as professionally as you can that you care about them. Well done."
And well done. And then you could also be very, at that core right there, that's got to start there. Again, for those of us who are phenomenological event, we get to add something to it, which is, if she needs some practical as well, like here's a safety program that worked for a client I had, I don't know if it worked for yours, maybe we could adjust it. If you ever need to talk about, like if you're feeling stressed out about this client and you need just blow off steam, I'm always in my office from this time to this time, come and we'll shoot the bull, and you know what I mean?
Exactly.
That the stress of our colleagues gives us an opportunity to care.
Exactly, it does. And interestingly enough, this client she's predominantly a CBT therapist. The therapist, my colleague, is a predominantly CBT therapist with some DBT thrown in, and from what I can tell, a lot of choice theory from Glasser. And what I like about this is you've got a CBT therapist practicing what she believes to be the best way to provide therapy, but she's kind of going against the CBT grain to a degree by having some of this compassion, which goes to show.
Because this is a challenge I have when I read CBT. I interrupted. And that is compassion contrary to cognitive behavioral therapy? When you talk to cognitive behavioral therapists, the ones I talk to say absolutely not.
Right.
Where I'm confused, and if you come across a colleague who's very well trained in CBT, better trained than I am, if you come across one of them and they say, here is compassion in our literature, here's how we understand it from a cognitive model, not as a prosaic model, because oftentimes our colleagues are very kind people, and so they bring in their value of kindness and compassion into their therapy, and they don't necessarily integrate it with their theoretical orientation. But I'm very curious, like, how would compassion make sense in an objective, programmatic, schematic model like cognitive theory? Is compassion just a schema that's activated or not? If it is activated or not, it's activated by stimulating the environment. Stimulating the environment, in this case, would be the client. So then it's the client who activates my compassion schema or not?
That's a very deterministic model, though. There's no human agency here.
Well, exactly, and so that's why I'm at a loss. And just this is a plea: if you happen to come across somebody who can make compassion compassionate rather than objective from a cognitive therapy frame, I would appreciate it.
Yeah, I actually would like to hear that myself.
So, in my world, most of the therapists that I relate to are interpersonal, existential, or systems, and so very, very few of my colleagues are cognitive behavioral. Just birds of a feather.
Yeah. Yeah.
So still, she seems to be going against the CBT brain. Because you and her share a value in common, this is your horizon is already fused.
Right.
I mean, the two of you already have this common understanding. You didn't have to work towards it. You've already got this understanding. Compassion is good. Kindness is good. And so the two of you already have that in common. You don't need to establish that for it to move ahead in your relationship with this colleague. So instead, it already facilitates your efforts to support her and training moral support.
Exactly.
Because it's our job, and this is something you and I have talked about repeatedly from various perspectives, is to live our theory. And that, we argue, and this is more controversial, not to us, but to some of our colleagues, people always already live a theory about what the good life is, what I'm supposed to be doing right now, what it means, what the purpose is. People always already live their theory. And so for us, it's what is ultimately the goal of hermeneutics, and we talked about this over lunch. So would you reiterate, like, for a phenomenological hermeneut, what is the point of being? Because when we understand that point, then we bring that point of being into therapy.
Well, that's a question that, as you know, has been answered by numerous fields. Like, just real quickly, the example of a evolutionist. The purpose of being is to pass down information to the next generation.
That is for an evolutionist.
But for hermeneutics, despite what all the other countless theories out there from the various disciplines and subdisciplines might say, for us it's about caring about others in a way that then helps them or models for them how they can go out and care about others in turn.
Okay, so we are we are relators of compassion. We relate to other people compassionately and encourage, or sometimes only hope, that they in turn will relate to others compassionately.
Right, and the second part of this, I would say, the second part of this goal, because every goal has got to have a sub-goal and a parameter, right?
Nope.
The second part of this is just this idea that compassion is going to require a great deal of understanding the context from which the client comes from. I like how Paul Ricoeur says it, that we always seek to understand before we seek to explain. So
we should always.
We should, yeah. No, right. That's not that what we always do. We should always do that. And I like that because the goal of hermeneutics is not to listen with the intent of how to intervene. The goal is to understand, or is to listen with the intent to understand and therefore have compassion.
Yeah. And so how do we respond then when our colleagues say, your compassion does nothing? There's no technique that you use, there's no guidance, there's no recipe book.
Yeah.
Like, your compassion is not therapeutic. How do you answer that?
Well, putting aside my quiet mental frustrations of therapists needing an instruction manual for virtually every situation, what I would think to myself is, there is a degree of truth to what they're saying. The compassion in and of itself is only going to do so much.
Yeah, sometimes people are compassionate, they feel a great deal of compassion, but feel helpless.
Right, exactly. So, and this is where I do like some of what CBT and DBT has to offer, where you can start giving skills from the outset, the very first session of therapy, and I got a client, if I were to have a client coming in saying that they have a problem with punching walls when they're angry, you know, very first session, I'm going to say, well, we're going to talk about that, but in the meantime, here's opposite action, here's how you use it. So right now, they've already got something to empower them. But this is only going to go so far. Just like the compassion can't work without the skills to empower them, the skills to empower them may not be as effective without the compassion.
Or maybe problematically effective.
Exactly.
They may help them do things that we would really stay up late worrying about.
Right, exactly. And so, like, for example, I'm feeling suicidal right now. I want to, I would rather not kill myself, but I'm going to use opposite action and kill myself. Because there's no one cares about them.
Yeah.
So why?
Yeah.
So.
I don't think that would be a good or even comprehensible use of opposite action.
No, it certainly wouldn't be. It is by far a bad example, and does DBT absolutely no justice. It actually might even do DBT an injustice.
Right. But that's something that a client can misuse DBT
Right.
on. It's
Absolutely.
not DBT's fault.
Right, and not at all. It's not at all DBT's fault. But with the compassion, once the person knows that they care, that the therapist cares, that there's compassion, they are intuitively going to share more about their background, their horizon from which they come from in life and who they are with you, that is going to allow me as the therapist to say or present some possibilities of some very personal, individualized skills that aren't found in a manual for therapies anywhere.
Yeah.
We're going to help them uncover their own skills, but they're not going to be able to do that or even reveal anything that would allow me to come up with them until they first know that I care enough about them to say something. It's like what happened with that client of mine. No, he's actually not my client, but in the hour that he was in my group therapy session, he was my client. He's actually Deverell's client, though. You know, for 35 minutes, it was, I can't get out of the gang, I can't this, I can't that. But then as soon as I validate him and have compassion for the inescapability of his situation and the very real predicament he's in, that's when he opens up about how much he loves the power and the money. And that's what enables me to
So why are
say,
you really staying in the
right,
gang?
so why are you really staying in the gang there? And he's, oh my gosh, Kev, you are so right. I'm my own worst enemy. So to go back to your question now, I think a CBT and a DBT therapist would be very right to say, okay, so you have this compassion, but how is this empowering the client?
Or how is it changed?
How is it
or
changing?
needing to change or something?
You know, and I would say that first off, it immediately has a very germinal effect of empowerment and change just by the sheer fact of the client knowing someone cares.
Right.
It's a very germinal effect
whether
there.
your theoretical orientation is CBT or phenomenology, that when the care happens and it's real, that's powerful.
Right, in and of itself.
Yeah.
Now, I think a CBT or a DBT therapist, or even an eclectic therapist, is going to say, right, but that I will agree with you, but you are right when you say, Kevin, that it's still very germinal. And here's where I would agree back and say, but once they care, this is when they open up. And it is when they open up and the manifest is now made given, to use Marion's term, given, being able to completely understand it.
To really allow it to be given to our consciousness,
Right.
where we think deeply about it.
Think deeply
experience
about it. We, as the client and I, are now in a position to really look at the tools that the client has embedded within their own lifestyle, within their own background, and say, here is how you possess what you need to get out of this. And now a DBT therapist is going to be very sympathetic to that because, and it is very similar to what Marshall Lenahan's saying, where you got your DBT toolbox and you got your personal toolbox. That's essentially what we're saying here. The personal toolbox is going to be deeper and have more breadth from a phenomenological point of view, but we're only going to get the depthness and the breadth of those personal skills through the vehicle of compassion.
Mm-hmm. I know. I was thinking of it as you were talking. It really reminds me of an experience I had some years ago. My graduate students were watching me do therapy, and they were shocked and some downright appalled, because with a particular client, and I actually do this quite regularly even to this day, I propose that we do an experiment. Well, then, knowing my philosophical bent and how I'm a little bit suspicious of objectivity and science, that They were, oh, you're an eclectic and everything you've taught us is false, you know, engaging in that very neurotic black and white thinking. And I said, what experiment did I have the client do? Client. Suffering, seemingly on cue panic attacks. Out of the blue. Just, she'd be walking across campus, meltdown, major, thought she was done. And so she came in, and the first few weeks of treatment was as mysterious as me as it was to her. So I had her keep meticulous track in 15-minute increments of her life. What happened in the last 15 minutes? What happened in the last 15 minutes? What I found is every day that she had a panic attack, her mother had called her and she had a conversation with her mother sometime that day, usually within the past hour. So she's walking across campus, that seems to have nothing to do if she got off the phone with her mom an hour ago. Right? But every time she had a panic attack, every time, she had been in she'd been in conversation with her mother. And so it was interesting to me that she had very carefully not brought that up our first few sessions of therapy. She had not mentioned her mom, not talked about her mother. And so I said it was time for us to talk about mom. We learned from mom, we learned about mom, that in the client's experience, mom is one of those teddy bears full of fishhooks kind of moms, where she seems very soft and loving on the outside, but when you get close to her and you touch her, there's a lot of barbs and bleeding that happens. Mom's the kind of mom that says, oh, sweetie, thank you so much for coming over for dinner on Sunday, and I didn't want to tell you in front of your new boyfriend, but the skirt you were wearing that day makes you look fat. Jeez. And I'm only telling you this because I love you, but you might want to either lose some weight, which I've been encouraging you to do a long time because I love you, or maybe wear a different outfit, because it's going to be really hard for you to get into the altar if you're fat like that. And so that's the way mom communicates, teddy bear full of fishhooks. And so she and I talked about whether or not she wants to, she loves mom, she's loyal to mom, mom does indeed do a lot for her. And so I just proposed an experiment. Let's go through and not talk to mom for a week. Call mom and say, I'm really busy this week, mom, I know we talk, several times a week, but I'm going to really be busy. And she had a panic attack trying to have that phone call. Jeez.
I actually use.
And so my students say, oh, that's cognitive behavioral. I can see a cognitive behavioral therapist using that same technique. But the end and the goal is very different. For me, the experiment is not for her to have an objective, scientific, empirical experience that then teaches her the truth and changes her understanding. But instead, experiment comes from the Latin root expia, which means to experience. She and I weren't having an objective scientific experiment, we were having an experience. And by her having the experience and bringing it and talking about it, it became a shared experience. It took her weeks of panic attacks before she finally asked mom. And mom gave her the teddy bear with fishhooks response, just like we had talked about and warned about. Like Alfred Adler was genius when he talked about spitting in the soup and some of his other techniques. But mom, oh, but I love you, and I know you're really busy, and just be anxious to call me back, because for this week I'm going to be crying because I miss you so much. The teddy bear full of fishhooks response. And so finally she did. She worked up to it. She doesn't talk to mom the entire week. Not a single panic.
Yeah.
The thought of calling mom on Sunday, she wakes up Monday morning, this is the day I promised to call mom, panic.
Yeah.
And so from there we learn so much more than if we just say, okay, we're going to do an experiment. We're not going to validate how much you love your mom, how loyal you are to mom, how you'll feel ashamed and guilty being this disloyal to mom. We don't do that. Instead, we validate. We understand this is difficult, and there's going to be a lot of shame, and the love and loyalty is real, and that's what makes this whole process difficult. And that's why we propose, but we do not force.
Mm-hmm.
Would you be open to trying? Similar work, I've noticed you and I have a very similar style of trauma, that if a client comes in and we can tell they've had a trauma experience, we open the door for that to be discussed, but we don't push them through.
No. Mm-hmm. No.
I invite you to talk to me about this when you're ready, and every couple of sessions I'll remind you of the invitation, but anytime you want to take that up is up to you.
I agree. I'm going to check to make sure that recording's still going.
Not a problem.
Yep, still going.
Okay, well let's actually take a break.
Sounds good.
Because the kids are going to be home any minute now.
Okay.